Hi and welcome back. It's been great doing these little videos for you guys, and I'm really excited to talk about our newest one, which came from a question from a viewer who asked about what to do for postpartum care and all of the aspects that come with that. So it's really critical to say that postpartum care is very important, and there are sort of three critical elements to it. Number one is the emotional component. Number two is healing and recovery from pain, often from a tear or from a cesarean section. And number three is issues with breastfeeding. These are pretty big topics, so today I think we're just going to focus on one, which is the postpartum blues or depression aspect of it. So it's certainly common for women after a delivery to have postpartum depression or mood changes. There's a lot of factors that go into this. The length of the pregnancy, the hormonal changes, which can be quite drastic after the baby is delivered, exhaustion from not sleeping, you're getting up frequently for taking care of the infant, and also just the aspects that are involved with generally adjusting to a whole new lifestyle with a baby to take care of, constantly having to attend to someone else's needs, plus all of the other things that you're doing at home as well. Certainly we all know that moms are incredible women and they are constantly doing 10 jobs at the same time. So that can eventually weigh down on almost anyone and cause you to change your moods, sometimes become depressed. When you are feeling those sensations, first it's important to recognize this is a normal part of the process. And second, it's important to recognize when you need help. If it's becoming a very significant element of your day where you're not finding enjoyment, you're having trouble adjusting to the changes, you're not finding it pleasurable to be with the infant or with your partner, then it's definitely time to talk to one of us, the obstetricians, or at least your family physician. We are all very sensitive to your needs at that point in time. No one is going to belittle them, and no one ever should. It is critical that we take care of our moms who are adjusting to this new phase in their life, because these changes can be drastic and sometimes they can be critical enough that patients really need help, whether that's psychological help, psychiatric help, and sometimes medical with medications that we use to assist. There are some patients that will need a brief period of antidepressant use. This can certainly be used to help stabilize the moods, improve your sleeping habits, help you enjoy your time with the baby and with your partner again. And frequently after a few months, it's no longer needed, as you can come out of that depressive state and return to whatever state you were in before the baby came along, and more of a normal habit for you. There are some patients where it tends to be more severe, and those patients will need continued help and frequently counseling as well. By all means, if you ever feel like you're hitting a low, you are tearful, you need help, turn to your family doctor, and by all means turn to your obstetrician. We're here to help you out, and we really deeply care for you, not just during the pregnancy and during your labor and delivery, but we're there for you after the pregnancy as well. It's been an honor to be there for my patients for their fertility, but I've also really enjoyed being part of their prepartum, antepartum care, as well as their postpartum care to help them get through that phase as well. Again, we thank you all for your time and for viewing these videos. As always, share with your friends, throw up your comments, and if you have questions, put them up there and we will attend to them as soon as we can. We'll look forward to talking to you next time about recovering from the pain and some of the tips and tricks we use for pain recovery, as well as breastfeeding issues. Have a great day.